Thank you, everyone. It's a pleasure being here. Dear, I will present this paper that we have been working for 10 years, more or less. Okay, internal breast reduction is a big issue because sometimes we are working only with skin, muscle, and also the glandular tissue. The size proportion with the body is not always symmetrical or is the shape that the people or the lady wants to have. And to improve the discomfort associated with the large natural volumes is so important right now. You know, all the fashion things are completely understandable right now. We have different kind of surgeries, the circular pattern around the areola, in order to reduce the volume or to put the nipple areola complex a little higher or in the right position. We also have a keyhole or racket shape pattern with an incision around the areola and the vertically down to the breast crease. An inverted T or the anchor shape incision is also another example. The incision lines that remain are visible and permanent scars, although usually well concealed beneath a swimsuit or a bra to cover them. Some patients would like to reduce their implant's dimension about 1 or 2 sizes without having a new scar. Considering the skin and the muscle previously involved, this presents a problem for the surgeons who have to perform a technique without long or bigger scars. We have been using this technique, which allows us to perform an easy and efficient implant volume reduction, avoiding the scars consequences of the breast lift surgery. To achieve this procedure, we require that the patient fulfills the following requirements. The implants must have to be placed under the pectoral muscle since the beginning. The patient's skin must have to be thicker. The nipple areola complex requires or not a certain height reposition depending on the breast characteristics. If they want to reduce more than 2 sizes, the techniques will be not helpful. Pregnancy or drastic weight loss might affect surgery results. They are not candidates for this technique. With patient is a standing position, we proceed to mark the new inframammary sulcus. And if necessary, we reduce the axillary pocket, as you can see here. And we also perform the incision in the same place where the previous scar has been made, allowing us to remove the previous scar completely. The tissue is dissected up to the implant until it is free to be removed in exchange for a small size. Marcation is the most important thing here. We need to mark the areola. We need to mark also the breast reduction pocket, as you can see here. All the pocket needs to be completely marking. And we can lift the nipple areola complex when it's necessary. We suture the chest muscle to reduce the size of the pocket. You will see that in this video. And it's so important that all the extra space left from the previous implant is sutured together in a circular fashion way. In mustaches is reviewed if there is need. Continuing to close the pectoral muscle fibrosis capsule with the superficial fascia of the west wall. There is no need to perform a capsulectomy, and at the end, a small breast implant is inserted. Sometimes we create a poker under the breast tissue over the fascia muscle. The nipple areola complex is repositioned 1 or 2 centimeters above the original place in order to leave it higher. If it's necessary, we suture the nipple areola complex at the central or side level, depending on the patient's need. As you can see here, how we pull up the nipple areola complex. This is an example, before and after. This lady reduced from 500 cc's to 300 cc's. Here you can see in one side, here, the reduction of the implant, and also this in the right side, we haven't touched it yet. At the end, we can use some glue in order to close. These are some examples, pre and op. And in the first, on the left, you can have the pre-operation picture. Is 550 cc's, and we reduced to 350 cc's. As you can see, the shape and the size are quite good right now for this lady. Before and after, different views. And we also relocate the nipple areola complex in this lady. This is another case, before and after. The use of post-surgical bra for 30 days is recommended, also back sleeping, general care of mammoplasty, and avoiding any type of strength effort is necessary. In conclusion, the proposed techniques allows breast reduction with smaller implants without increasing the number and size of scars, which is very pleasant for the patients, is not painful, and requires less recovery time. Allows to relocate the crease of the breast, maintain the implants and the breast tissue in the right position. If you have any question, I will be so glad to answer them.